Hi, I'm Eleni Tsigas. I'm the CEO of the Preeclampsia Foundation. We are the patient advocacy organization for preeclampsia and hypertensive disorders of pregnancy, headquartered in Melbourne, Florida. We are actually international organization because we certainly cover all of the United States, but we also have a Canadian affiliate, and we are involved in an awful lot of global health work around preeclampsia as well. Although we're headquartered in Melbourne, Florida, and our office is here, we also have a number of remote employees across the country in different capacities. As a nonprofit organization, of course, we are governed by a board of directors, more than half of whom have been personally affected by preeclampsia. All are extremely passionate about the cause. We also have a medical advisory board that truly represents the who's who in preeclampsia, and as well as a special advisory board of medical and scientific experts who help us with the preeclampsia registry, which is a very important research asset. And finally, we also have a patient advisory council that represents the diversity of experiences that we can all have and bring to this experience, as well as demographic and geographic diversity. Our vision, pure and simple, is that we envision a world where preeclampsia will no longer threaten the lives of mothers and their babies. And we do this through our very purposeful mission, which is to improve the outcomes of hypertensive disorders of pregnancy by educating, supporting, and engaging the community of affected individuals, improving healthcare practices, and ultimately securing a cure, a prevention and a cure for preeclampsia. So inherent in that are the three pillars of our mission. And I'll just give you a couple of examples of some of the programming under each of those pillars. Within our community outreach, of course, patient education is at the heart of what we do. We fundamentally believe that all pregnant people need to know the signs and symptoms of preeclampsia. And everything that we do is sort of undergirded by this desire to ensure that education is pervasive in a number of different formats, through a number of different channels, but primarily by influencing healthcare providers to do this education as part of their normal standard of care. So patient education also happens, of course, through our very robust website and social media platforms. In addition, we have community outreach through the Promise Walk for Preeclampsia, which is held in various communities across the country. Within healthcare practices, I think of what we do in this area as kind of running on two tracks. The first track is we need to get all healthcare providers operating from a baseline of fundamental care. And that's making sure that nobody slips through the cracks because of poor care. And there's a lot of work associated with doing that. We work with states, we work with our advocacy teams. We do a lot of talking, educating, doing training sessions. There's a lot that we do to ensure that all healthcare providers are providing that baseline of care. That said, that's not enough, and we need innovation in this space. And so a lot of what we're doing to drive innovation are things like our Cuff Kit program, where we are working to equip all moms with their own blood pressure cuffs during the prenatal and postpartum period, kind of as an extension of that idea of education being very empowering. So education not only around symptoms, but also around blood pressure. And so there's a lot more I could say about that program, but at this point, it's pretty pervasive. We've distributed over 25,000 blood pressure cuff kits to about half the states in the country, working with well over 200 different provider groups. We also do a lot around advocacy. We do believe that our voice matters, and frankly, our voice does matter and has been received openly at tables where we are discussing guidelines and better practices, not just best practices, but better practices. And so that means advancing things like better ways to diagnose and predict preeclampsia. There are a lot of tests that are being developed now that we think need to be introduced into the market. So there's a lot happening around advocacy, both at the federal level as well at the state level and with professional societies. And then in the third pillar, research, primarily two things that are happening here. One is that we are funding very critical research that needs to be done. We're also operating the preeclampsia registry, which has over 8,000 participants in it that include information that they've reported, that has been collected from their medical records, DNA samples, and literally dozens and dozens of investigators are using this information, plus creating their own information that we're then putting back into the registry. So it continues to become a living, dynamic database that can inform research questions and provide answers. So that's a brief description of our mission and some examples of the programs that are done within that. I'm going to save the best one for last, or not the best one. We have several good ones. The values that we operate under really pervade all of our mission areas. As you've heard over and over again, we are patient driven. Everything we do is through the lens of the patient. We ensure that we have that vantage point through some of the many programs that I've talked about, through the many stories that are posted on our website, social media engagement, getting out into the community and actually talking to the families and moms who have experienced this. There's a lot of ways that we ensure we are always collecting and having and maintaining that perspective, that patient-driven perspective. We are knowledgeable. One of the things that we work hard at is to ensure that we are going to be a credible leading resource on the topic of preeclampsia. So we stay well informed, we ensure accurate information and timely information, and we're constantly seeking guidance from our medical advisors. We ensure that we are empathetic in our approach. Many of us have personally experienced these conditions and understand that it is personal with us. And so we work hard to treat everybody with compassion, with sincerity, and to essentially treat each other with human kindness in knowing and recognizing and having personally experienced how traumatic this can be. Fundamentally, all our work is collaborative. We do not take an adversarial approach to other stakeholders that we need to work with. We seek to build consensus with each other, within our community, and with our partners. At the same time, we are always maintaining that what we are bringing to that collaboration is that patient perspective. We ensure that we are trustworthy to our donors, to our partners, to our community, that we are acting with accountability and transparency, and that we maintain your trust and confidence in us. And ultimately, we are catalytic. That is, we are small, but we are mighty. We stimulate action and we accelerate advancements in the field. And we see this over and over again. These values are persistent through all of our mission areas and all of our programs and services. So in keeping with those values and our belief that patients can and should be part of all of our solutions, we created Mama's Voices. Now, Mama's Voices is a coalition, and it's not just a coalition of organizations that work on preeclampsia, but actually all the conditions that affect maternal health and maternal outcomes. So you're going to hear more about that. I'm actually going to introduce you now to Nicole Purnell, who is our program director for Mama's Voices, and she's going to tell you more about that program and a lot of openings that we have on that team.
Hi, I'm Nicole Purnell, and I'm the program director for Mama's Voices. Mama's Voices is a program of the Preeclampsia Foundation that was created in 2018. It was really developed with a community and a coalition of organizations, many different patient advocacy organizations and community-based organizations as well. We realized that there were several things that we all had a common interest in, and that if we came together, there was power in numbers. Right now, we have over 20 organizations that are part of the coalition. And again, we represent many different causes, conditions, and communities. Mama's Voices program equips and activates the voices of those who've experienced pregnancy and childbirth complications or loss, especially those who've been historically marginalized, to partner with providers and researchers to improve maternal care. By doing this, how we've done this is we've created several different training programs for various roles, including one specific for families, survivors, and close friends with our patient family partner program, as well as a training program for different healthcare providers on really learning how to work together. We offer matchmaking services similar to a speakers bureau as well. So we are able to take these roles and the people that we outreach and engage with and match them up so that they can continue to work together. The goal is that we're changing the culture where patients and healthcare providers partner together to create solutions. That's why we need more people on our team to help identify and recruit patients and their families into our work, to help get them trained on how to use their voice, to help match trained advocates with opportunities to engage and use their voices. These paid positions will join our team in outreach, engagement, training, and matchmaking, and you can be a part of that work.
Even if your interests and professional skills don't align with some of the opportunities within Mama's Voices, we may have other openings at the Preeclampsia Foundation. So we welcome all interested applicants. We recommend you spend some time on the web at preeclampsia.org and mamasvoices.org to learn more about our organization.
If you're interested in joining our team in a full-time or part-time capacity, here's what you need to do. Click the link below to record a brief video of yourself answering the prompt questions. It will automatically update our account when you're done with it. Once you completed your video interview, please email your resume to hr@preeclampsia.org with the subject line MV, including your last name, and insert your last name where indicated. If you've ever taken a professional development assessment like the Gallup StrengthsFinder, Working Genius Model, Myers-Briggs Typology, or the DISC assessment, please include that information on your resume as well. This will help us to use your strengths for the right opening. Our team will review your resume and video submission and then contact you if we'd like to move forward with a further interview. Thank you so much for your time today and learning more about our program. We hope to hear from you soon.